So everyone, a reminder, we are live right now and it's recording. We'll start the meeting promptly at 9 o'clock. Hey, Kevin, before we get started real quick, at the end, we're going to talk about the LEOPS bill, and maybe we can take a few moments there at the legislative request. So I think this might be the right place for that. So kind of be ready for that one.
Yep, sounds good.
Okay, good morning. I'd like to call the meeting to order. If everyone could please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Justice for all.
Delgado, would you care to say the prayer for us this morning?
Yes, Mr. Chairman, thank you for the opportunity. Let us all take a posture of prayer. Dear Heavenly Father, we thank you this day for bringing us together, be it virtual, but give us the wisdom, the courage, the honesty, and integrity to do the will of the people of the Eastern Shore of Maryland and to represent them as they would have us represent them. And we ask for your guidance and direction as we go through these session of the 435th General Assembly. In your name we pray. Amen.
Amen. So good morning. Welcome to the Eastern Shore Delegation meeting. Today is January 20th, 2023. Today we'll have the Honorable U.S. Senator Ben Cardin speaking. We'll have some Q&As from the members for the senator, and then we have a special panel. Now, last week, you'll know that Tom Hutchinson has requested a bill to support a trauma care request for not only Tidal Health, but also other health systems that have a similar issue. And we've invited them to come in and present their need and also a general briefing. And we're pleased to have with us today also the University of Maryland, Baltimore and the University of Maryland Medical System. Ken Cazell's talked regularly about the new hospital that's coming. We're excited to see that come to fruition. But today they're going to be talking about a very specific need for which the delegation surely would like to get behind and support. And then we'll have the Maryland Association of Counties at the end. So before we do that, meeting minutes were shared with the membership. Those meeting minutes for this particular meeting are going to be longer than in the future. Betsy, my assistant, did an overly good job of doing the meeting minutes. So take a moment and read them if you haven't already, because she spent a lot of time on them. But can I get a motion to accept the meeting minutes from the prior meeting?
So moved.
Second.
Okay, all those in favor say aye.
Aye.
Okay, all opposed. So let's see, Kim, you're online. Do we want to take a few minutes and chat about something else until the senator comes in, or?
Yes, I know he's wrapping up. He said 9:05, so just a couple minutes.
Okay, if you don't mind, what we'll do, Kevin, are you there?
Hello,
Kevin
Karen.
Hornberger, Mr.
Yes.
Treasurer.
Hi, this is Kathleen. So I just checked the email. Here's what they said. This was on.
I think we have somebody who's not on mute.
Hold on, somebody's on. We can hear somebody.
Sorry.
Yeah,
So Kevin, real quickly, there's a bill that we know is coming up for LEOPS that appears to have a regional interest. Do you want to talk very briefly until the senator comes on about what that's like and why we might do that as a delegation bill for the Eastern Shore?
Yeah, absolutely. And I just left breakfast over there at Pace with the senator, so I know he'll be here any minute. But we'll go ahead and get started with on the optics of the bill. So we were approached by two counties, two jurisdictions that are looking at opting into LEOPS. As many of you know, LEOPS is a program where small jurisdictions can enroll their employees in a cost-sharing retirement plan through the state. And probably the number one utilizer of this program is your law enforcement in our small towns, be they Prince George's County, be they the Eastern Shore. So the way that it works with the state is that you actually have to designate with the state if your jurisdiction and then your title of employee is allowed to opt in. And then once that is approved at the state level, the jurisdiction can then decide what that cost sharing looks like. And they have to jointly agree to the terms. The employees are usually recognized or organized by a union. And then the government is usually the town council and the mayor. And in conjunction, they jointly decide to opt in and they start contributing to the program. And that allows for those employees to create a retirement savings. It's a recruitment tool, allows them to attract folks that want to build a career as opposed to post-retirement employees or retirement or employees that are short-term or decide to. Johnny, I think you got 2 feeds up there. So with that said and with that background, we decided that because this will be 2 jurisdictions, that we could basically guide this through the process as an Eastern Shore delegation bill, which is really exciting because in the 8 years that I've been here and then talking to some of the colleagues who've been here longer, that's never been attempted. And I think this will be a learning experience for all of us and give us a little bit more sure footing when it comes to passing bills in the future that impact the delegation. That's really a nonpartisan bill. And then there would only be a fiscal note for this bill if those jurisdictions later decide that they want to enroll in the program, again, jointly with their employees. So very simple, straightforward. I can get a list of the jurisdictions to you, Mr. Chair, that want to opt in. And this bill was brought to our attention by Melissa Bragg with the Worcester County firefighters, a local union.
So Mr. Treasurer, I think we have the senator on now. I will say that there was a sponsor in the House that was going to do a statewide bill, Feldmark, who's
Jessica,
talked to me, and it seems like they might be willing to pass that along to us for the statewide consideration. All right, we'll bring that back up at the end. Senator Cardin, are you there?
Chairman Adams, I'm with you. I hope you can hear me.
Good morning. It's a pleasure to see you. Thanks for being here today, and can't wait to hear news from Washington and how we can help you and you can help us. So I'll go on mute and the floor is yours.
Well, thank you very much. I really appreciate this courtesy. I always enjoy the opportunity of meeting with the regional delegations. I am in Annapolis, by the way, so I'm sorry we can't meet in person. I was at Mountain, Maryland this morning for their breakfast. Good breakfast, by the way. It was very nice. Yesterday, I was with the Southern Maryland delegation for the regional planning. This has been my week for Annapolis. Wednesday, of course, with the governor swearing in, and Monday with the controller swearing in. So I've been in Annapolis 4 days this week. Unfortunately, next week, Congress resumes. So I have to go back to Washington. It's a lot more fun in Annapolis than Washington. So it really is good to be with you. And I want to just start by saying that I'm very proud to represent the Eastern Shore. I think we've been very effective in providing the type of help that you need to deal with the challenges. And I just want to stress the fact that one of the reasons we're able to do that is because it's Team Maryland. We work together as a team. We have unity in our delegation on critical issues. And I want to give a shout out to Senator Van Hollen. The 2 of us share all information, particularly as it relates to the congressional earmarks. I also want to give a shout out to Congressman Harris. It's been extremely helpful in dealing with the Chesapeake Bay and regional issues. It is Team Maryland. And I know their representatives are always at your delegation meetings, always there, along with Kim Cradaville, who does such a great job representing me on the Eastern Shore of Maryland. I want to give a shout out to Kim Cradaville. So we work together as a team, work with the governor, we work with your delegation, we work with state and local officials in order to represent the people of the Eastern Shore. These last 2 years have been some of the most productive years we've ever had in the Congress of the United States. We passed a lot of bipartisan bills, the bipartisan infrastructure bill, once in a lifetime investment in roads and bridges are so important to the Eastern Shore of Maryland. Broadband, which is very important to the Eastern Shore of Maryland. We were able to get programs to help the Chesapeake Bay. $238 million was in the bipartisan infrastructure program to help the Bay. And then most recently, we were able to pass the Water Resources Development Act. I've mentioned these bills because they come out of the subcommittee I chair, the infrastructure subcommittee. But the WRDA bill contained $100 million for shoreline preservation in Maryland, which is critically important for our state. So that was an allocation I was able to get into the WRDA bill to help us deal with the challenges we have in Maryland. I know you're all familiar with the CARES Act and the ARPA Act that provided local resources. I can give you the exact amount that went to your county and municipal governments. For example, in Wicomico County, the total was about $58 million on the two programs. And in Somerset, which is a much smaller county from the point of view of the population, 13.8 million came in through the CARES Act, the ARPA funding to help. In addition to that, you received education money in the county, which was substantial as well, bringing in millions of dollars in total. And again, just using Wicomico County, it was 73 million. In the state of Maryland, it totaled about 2.7 billion that went to all of our counties. I have each individual county if you're interested in knowing those funds. We were able to get in this budget cycle earmarks done, congressionally directed funding. And we are very proud, Senator Van Hollen and I, on the programs that we were able to get funded through congressional earmarks. We had $6 million for infrastructure projects such as Hooper's Island Causeway, $1.45 million for economic development programs such as Maryland's Eastern Shore Center, $100 million on affordable housing in Worcester County, $645,000 for healthcare through the Lower Shore Clinical Co-occurring Disorder Treatment Facility, $2.5 million for education and workforce development at Chesapeake College, $2.5 million for community development, and the list goes on and on and on. $4 million on oyster restoration. So we were able to use that to advance some of these programs that we think are important. I want to just emphasize the areas of concern. We have the Farm Bill coming up. We're going to need your input as to what the priorities are for the Eastern Shore on the Farm Bill. We know that the poultry industry is critically important. What can we do during this debate? We have the H-2B continuing problems that our delegation is very much working in unity, all three of us, to get a separate allocation under H-2Bs for our seasonal workers. We think we're entitled to that for the seafood industry, and we're working on that issue as well. The Salisbury Airport, we've had several conversations. I recently had a meeting with the Wicomico County Executive and Council on the federal partnership and advancing the runway in Salisbury. We have water projects that are very important for the Eastern Shore, and some have been funded. We're going to get more funded under the WRDA bill with the increase in funds for the state revolving funds. So, Mr. Chairman, as you can see, there are a lot of opportunities that are out there. We want to work closely with the delegation on your priorities. The Eastern Shore of Maryland is a unique area. We know you know the community best. We want to make sure that we provide the support for its economic growth for your children and grandchildren consistent with the character of the Eastern Shore, which is so important to preserve. So we look forward to working with you in partnership and appreciate just this opportunity to start that discussion and to let you know we're available at any time, either directly or through Kim Cradaville.
Okay, thank you, Senator. And Kim's great, by the way. She's very accessible, and I wanted to talk to her a few days ago, and it wasn't 3 or 4 minutes. She was on the phone and we were chatting. So thank you for your leadership, but also your representation here on the shore. Senator, I'd like to ask just one question and then pass this to the members. Last week we had a healthcare related subject with hospice care. Today we're going to hear from 2 of our 4 systems on the Eastern Shore on direct requests and needs they have, more specifically on residency. So what we're finding on the Eastern Shore is some difficulties, if you will, having folks that are specialized, the doctors, and actually have them stay and work in the communities that you provide. My 8 years of office, access to care has been one of the top constituent issues that we've had. And I thought I'd ask you to opine just on healthcare and, generally what you think the Eastern Shore needs and how our partners that deliver healthcare can work with your office and achieving some very specific aims that seem to be workforce development related, and then also monies to help stand up trauma care, for example, and how we get these care at a very high level, which it already is, but making sure it stays there. So that's my question. Curious your thoughts.
Well, thanks for the question. Access to affordable quality healthcare is a critically important priority for our state. Maryland's in better shape than most. I am proud of the fact that we've been able to maintain our all-payer structure, which to me is important for rural healthcare because it allows for rural facilities to be able to function and get the reimbursements they need in order to be able to provide timely care. That's not true in the other states in the nation where the prospective payment system under Medicare rewards those institutions that are located in more wealthy communities. Now, so we have to preserve that waiver. It's in danger right now, and I've already had conversations with Governor Moore, and we'll continue to be a leader to make sure Maryland can preserve its unique hospital system. You are correct on workforce. Workforce is a huge problem. It was made much worse by COVID-19. Our frontline workers are reassessing their career choices, and we do not have enough personnel in the frontline workers, not just in the doctors, but also in the allied health fields. We need to produce more healthcare professionals. There are a couple of things that we are doing in regards to incentives for rural healthcare. We can build on those so that we can provide incentives for health professionals to serve in traditionally underserved communities. Telehealth has become a real godsend. We really upped our game dramatically with telehealth during COVID-19. But in rural areas, the travel time can be an obstacle to getting timely help. So therefore, expanding telehealth has been a major way to provide access to healthcare in rural communities. And then the area where we're having a major priority right now is in behavioral health and addiction. We still have a crisis on the Eastern Shore and in every community in our state. And we are very much interested in expanding opportunities we did under the Safer Communities Act in our schools. And we want to do a better job in providing access to behavioral health issues to identify those circumstances. One of the things we can do is to have facilities available for drug treatment rather than using our emergency rooms. And that's another area where in the Eastern Shore, you've been a leader in some of these areas in some communities. We want to make sure that our partnership at the federal level is strong and recognizes the unique ways in which different communities deal with the challenges of drug use. So they're just some of the areas, but the workforce challenges are real.
Absolutely. Thank you, Senator. Now we'll pass it to the panel members. Senator Hershey, you got a question?
Thank you, Mr. Chairman. Senator Cardin, thank you for joining us. And it was a pleasure to briefly chat with you on Wednesday. One of the things that we're going to hear a little bit more about today, obviously, is the hospital in Easton. And recently, Governor Hogan had recommended $100 million into the budget to jumpstart and support the building of this brand new, much needed facility on the Eastern Shore. We're waiting today to hear as the budget's announced to see if the Moore administration takes on that recommendation and puts that in the budget as well. But is there any help that you can provide at the federal level for this hospital? As you know, Shore Regional Health handles 5 different counties, and we've really looked at a hub and spoke approach to delivering healthcare services on the Eastern Shore. And this hospital is the integral part of that, the part that makes all of this run. So it's obviously very important to us, and just want to see if there's any opportunities for you to also help with this at the federal level.
Thanks for that question. Most of these decisions in regards to hospital bricks and mortar location decisions, regulatory approvals, et cetera, is going to be at the state level. So your primary focus is going to be the state. We can provide some help, but we're not going to be the major motivator of a project like this. It's going to happen at the state level. We do have 2 opportunities at the federal level to provide resources for a bricks and mortar project. One is under a federal grant program, a national program, and we can work with you as to the eligibilities. There's generally, just speaking, it's not a large source of funds. Normally we get 1 or 2 of our state hospitals a year get funding under that program. So it's highly competitive, but there is a chance that we can work with you in regards to that federal program. And then secondly, there's the congressional earmarks. And Mike Thomas of my office can help the Easton facility as to whether they could be eligible for a congressional earmark. Kim will put you in touch with Mike Thomas, and we'll pursue that for you.
Thank you very much, Senator, and we'll certainly talk to Kim about that. Obviously, this is very important. And Mr. Chairman, maybe we can participate together as a delegation to help move this forward with a congressional earmark for funding for this.
And it helps if it has a broader priority base than just one county. So if this is the priority for the shore, it makes a difference.
Absolutely, and I would think that as we all get together, we can certainly agree to that. So again, thank you, Senator, for joining us. Much appreciated.
Sure.
Delegate Jacobs.
Thank you, Mr. Chairman, and good morning, Senator Cardin.
How are you?
Good. Yeah, I put a lot of time and effort into this agreement over the Conowingo relicense, the lease with the dam up there. And as you know, the United States Appeals Court did vacate that decision. I'm just wondering if you are involved at all in this renegotiation with that. As you know, it wasn't a good deal the first time. Just wondering if you're involved in any part of this as we move forward.
So let me set the stage, because the concerns that you're raising, I hear frequently, and I agree with the concerns. Maryland farmers, particularly on the Eastern Shore, have done an incredible job to help us preserve the Chesapeake Bay. And then they look at what happens when a major storm occurs with the release of sediment and pollutants from the Conowingo Dam, because it is backlogged now. The reservoir has been totally filled. And they say, well, why are we doing all of our work here, making all these sacrifices, if it's all for naught as a result of not being done right on the Susquehanna River? And the Conowingo Dam has been the focal point of that anger. And I fully recognize that and understand that. I met frequently with the Corps of Engineers on this issue, and the Corps of Engineers don't totally agree with what is the right way to fix this. With the relicensing of the Conowingo Dam, we have a once in a 50-year opportunity to do something major in regards to this circumstance. And it's been reopened. And yes, I will be engaged on this. I will be meeting with the stakeholders, and we will be looking for the strongest possible agreement we can to protect the Susquehanna River's source of fresh water into the Chesapeake Bay, and recognizing that we have to have a solution to these major storms that are releasing so much pollutants into the bay.
I appreciate all that, Senator. I'm just wondering, as you talked about some of this, these earmarks and fundings, whether the federal government would be looking at possibly some remedy with the sediment that, as you mentioned, and as we know, the reservoir is full, and there was nothing in the original agreement, $500,000 over 50 years to deal with. I'm just wondering if there's any help in any conversation, financial help to deal with that settlement at the federal level.
It's a good point. I will check with the stakeholders, the major players in this, which are, of course, Exelon and the state of Maryland, as to what they are thinking about and whether the federal government can help in that regard.
I appreciate all your help with this, Senator Cardin, and all that you do, and I'll be in touch with him with some future conversations. Thank you.
Good, thank you.
Delegate Grace.
Thank you, Mr. Chairman. As you all can see, the camera on my computer must have broken over the interim. I left it in the office and I probably should have taken it home, but we'll work with what we have here and I'll have IT look at it. But nevertheless, Senator, I appreciate you coming. One of the key issues for us on the shore, and I think it's throughout the entire state of Maryland, is implementation of Kerwin, of the blueprint. And we're going to need you guys' help in one area, and that's that first pillar. It's the pre-K requirement for 3-year-old pre-K. Our school systems will not be able, well, according to the blueprint, 30%, at least 30% has to be of the 3-year-old pre-K has to be done outside of the public school system. So it looks like the lion's share of that 30% is going to be taken care of by our community action agencies, our Head Start programs, which are federally funded and they're run by the federal government. The challenge that we have with that, though, is that they can't expand because right now under current law, they can only take kids, I think it's under the 130% of poverty level. In Kerwin, it's written at 300%, and then it's sliding scale between 300 to 600%. So for us to not leave kids out of the program, we're going to have you guys hopefully increase that percentage of poverty from 100, it's like I said, 130 or 140% up to at least 300. So that'll make it a lot easier for us to be able to implement that 3-year-old pre-K function. I know it's a priority for a lot of states across the country. Because obviously daycare is a big challenge for those families where both the mother and the father are working. So this is the one way that we can certainly help our local school systems, and we can definitely use your help on that.
Thanks for bringing that to my attention. I was not aware of this cliff that you have on eligibility. The blueprint is a model for the country. We've introduced certain legislation to give Maryland financial rewards for moving forward with the blueprint. We hope that we'll have a chance to reauthorize the Elementary and Secondary Education Act in this Congress. That's not a certainty. It expires. We need to have it done, but I don't know if we'll get it done or not. There's going to be a lot of attention on pre-K and early childhood education and childcare in this Congress. And your suggestion is one that we will try to advance, because I think you raise a very good point. And it's something we were not aware of until you just raised the question here. So I will take that back to our delegation and see whether we can get some traction on that. It's a good suggestion.
All right, thank you.
Okay, Delegate Senator Mounts.
Thank you, Chairman. Senator, it's great to be with you. I just wanted to reiterate the issue raised by our Minority Leader Hershey about the hospital. It's about two decades old. It's been going on for a long time. And, Governor Hogan did put a recommendation in, but it was probably 4 years too late. I mean, we've been through hoops and hurdles where federal grants have come and to build this new hospital, and they've been returned. And we're starting a new era, and any help that you can provide, even emotional and supportive, discussions and things like that, just to highlight the need. We've got a number of challenges with our rural healthcare delivery. The trauma the trauma center in Salisbury is a huge deal, but also this hospital. Anything you can do to help us with your discussions and connections would be fantastic. And I just wanted to thank you again for all you do to be there for us, to help us out. So good morning. And there's no need to, I just wanted to reiterate that for you.
So how's the adjustment to the other body?
I'm working on it. I'm trying to learn it every day, sir. Trying to learn it every day, doing the best I can.
Well, since I'm a former member of the House of Delegates, not the Senate, I don't understand why you want that demotion, but whatever it was, it was.
Yeah, home is home, right? If I ever get across to the House of Delegates, I'll tell everybody I'm home, and The home's getting larger and larger. I enjoy every day. So thank you.
Congratulations. Congratulations.
Senator Cardin, I smiled. He's my colleague, and we look forward to working with him in the Senate, but we have the best chamber here in the House. I don't see any further questions. Senator Cardin, we're going to have the next panels come through. Thank you for the opportunity to hear from you, and all the best. So,
Thank you. It's a pleasure to be with you. Thanks for the courtesy. Appreciate it.
all right, so members, we're going to move to the next set of conversations. The one last week emerged. As you know, Tidal Health has a request that's not just for Tidal Health, but is a regional request. Senator Carrozza and Delegate Hutchinson are bringing important bills that relate to trauma care. So we're going to hear today from Tidal Health about that issue, and then other things coming forward. And then after that, we're going to have University of Maryland Medical System, University of Baltimore talk about their needs as well. So I thought it was important to bring Tidal Health in. Just know that we have the Secretary of Health. The Secretary of Health is going to come in at some point in the near future. We're going to invite, and we'd like to invite all 4 health systems to come back and briefly present if it's their wish. But this is a direct request for meeting and need for us to participate in helping them. So without further ado, we have Steve Leonard, and we also have Chris Hall with Tidal Health. And it's a pleasure seeing you two gentlemen, and thanks for participating with us today.
Thank you, Mr. Chairman. We're just, as you mentioned, we're going to go through 2 major topics, trauma care, because as you heard from Senator Mounts there, that trauma care is in jeopardy on the shore. It's the only trauma center on Maryland's eastern shore, covering not only Maryland, but also Virginia, as well as Delaware. And then also talk about the residency journey we've started, the importance of residency, but also both of these topics, the funding that is necessary. And we hope to make this a significant topic for this delegation to take forward this legislative session. So what I'm going to do is I'm going to ask our CEO, Dr. Leonard, if he can go ahead, and he's driving the slides, and he will provide an update for you all.
Great, thank you, Chris, and definitely thank you to the delegation for taking the time to hear about these important topics. I have shared my screen. Can you see it okay? Great, thank you. So our first topic today is talking about trauma care in the state of Maryland, and know that we've been in conversations with the HSCRC since 2017, including a full rate application that was unsuccessful in really deriving appropriate funding for trauma care. So this conversation has been going on for a number of years. And in the settlement that we had in our last full rate application, they encouraged us to seek legislative support. I want to put out there, though, that quite frankly, I do think this is an HSCRC issue in the long term. So we have 2 requests. One is for direct funding in the short term, as well as the establishment of a task force to study trauma care in the state of Maryland, because ultimately, I do believe that is where the solution lies. I think for most folks, there is an awareness that we are the designated trauma center for Maryland's Eastern Shore, one of a few in the state, and trauma care in the state of Maryland is expensive. We are a level 3 trauma center, but quite frankly, it's more like a level 2 that you'd find in other states. It's a high level of care with about a dozen specialties on call. And obviously, we are the only one, as you can see by that map, on Delmarva. What's fascinating is that these are trauma patients that we treated in the last couple of years. You can see that other than shock trauma, which we're privileged to have in this state, the world's leader, we are the second busiest trauma center in the state of Maryland. All of these dots represent a trauma patient that came to our facility in the last couple of years. So you can see we service an entire region, not just Maryland, but a little bit in Virginia, and obviously a lot in Delaware. Here's our numbers for traumas. Again, we are the second busiest from an activation perspective. Our ER visits have gone down a bit, but you can see our traumas have not. And actually ER visits are going up. Why are we so busy? Well, I don't think it's anyone's surprise. When you have the population growth that we have, as well as the destination, everybody from the mid-Atlantic states comes to Delmarva to visit. Unfortunately, while they're having a good time, they often need hospitalization and services therein. So it's great to have Ocean City, but it does drive quite a bit of services with regards to our campus here in Salisbury. I want to point out that this is a significant topic when you're talking about trauma. This is a life and death discussion. I know I've got some EMS folks or people who worked in EMS previously here on the line. You all remember Time to get to a hospital is critical, and the location of the trauma center being in Salisbury is important when it comes to drive time and destinations. It's great that we have helicopter service, but you have to keep in mind that the helicopter doesn't fly in bad weather. So the center down here has to be prepared for everything. And fortunately, we're able to take care quite a bit. Fortunately, we're able to ship some stuff up to shock trauma that needs that higher level of care. But our location is crucial to being able to take care of Delmarva. There's quite a bit of literature out there with regards to distance to trauma care. So again, this is life and death. That's why it's not just an Eastern Shore delegation issue, it's a state of Maryland issue. Think about all of the folks who come here from Baltimore, from the Western Shore, who come to visit. They want to have good health care. They want to have the ability to receive high quality trauma care. They want high quality open heart care, cath labs, you name it. And all of this is really driven by our ability to staff and operate a sophisticated level of service such as this. Here's a picture of the golden hour. Again, as you work your way further east, now this is just for Ocean City, obviously, but we do service that entire region. And again, the helicopter doesn't fly. And then again, 77% of our patients are from Maryland, but we service Virginia, Pennsylvania, we've got Jersey, the Carolinas, you name it, as they come down to the shore. Now, one thing I want to point out that's crucial with regards to us being a trauma center on the state of Maryland is not just trauma. Because we have the level of specialist coverage that we have, which is completely atypical for every other hospital here on Delmarva, these all represent transfers that we receive from other hospitals. So Senator Cardin talked about the difficulty of being a rural hospital today in America. It's very hard staffing specialist and subspecialist coverage. So what happens is these dots are patients that started out at another hospital last year and who were transferred to Salisbury because of the specialist coverage. So our ability to be that tertiary center as a trauma center actually supports every other hospital in the region in the ability to take care of higher levels of care. Those could be cardiac patients, stroke care, ortho trauma, you name it, but these are all transfers. So no matter what hospital you are in Delmarva, chances are you've sent us patients. Again, we're privileged to have Hopkins and University of Maryland in this state. It's phenomenal having that level of care. But I can tell you, right after Hopkins and Maryland, they're calling Salisbury for transfers almost 1,000 times every year here on Delmarva. We have engaged multiple parties. We did put a request in through both Governor Hogan's office, as well as incoming and now Governor Moore, as well as our previous chairman here, for trauma funding. There's two aspects to our request. One, we'd like a bill put through that would establish a task force to study trauma care in the state of Maryland. Because then, again, ultimately, I think it's important to talk about where this funding comes from, not just for our hospital, but even Western Maryland, Meritus, and even in the city of Baltimore, it's hard funding trauma. So we really need to study that within the state of Maryland. What we're asking for is funding to help our center stay open. Last year, the hospital lost $50 million from operations. This year, we're projected to lose $40 to $50 million. When I say our trauma center is in jeopardy, I mean it is in absolute jeopardy at this point in time. We will have to look at, without funding or support, can we continue to do this? Can we continue to be that center? So we're looking for temporary funding for the next 2 years, while ultimately we establish a long-term plan for trauma within the state of Maryland. All right, so I'm going to switch gears and then we'll take questions and talk about graduate medical education. What's phenomenal about the platform in Salisbury is that with the significant volume in pathology and the medical staff expertise, we actually have a very robust platform for medical residency training here in the state of Maryland, specifically rural medical residency training. If you're not familiar, back in 1997, the federal government, in every other state, and even in the state of Maryland prior, CMS funds residency through CMS rates. But the Balanced Budget Act of 1997 put a cap on existing hospitals so that they could no longer grow residencies. So we've had medical schools open up throughout the country, but the ability to establish new residencies at existing programs was limited by that cap. What's interesting is that cap does not apply to hospitals that do not have pre-existing residencies. Our friends up at Bay Health are well on their way to graduate medical education, and they're automatically getting funding through CMS rates. But in the state of Maryland, the HSCRC has decided we're not going to apply that rule, and they really should. So we have a significant challenge from a funding perspective. In our last rate application, they gave us permission to go ahead and develop the residencies that we want to develop, but they said, we'll count you from an efficiency perspective, but we won't give you any funding. And that's not good enough. The state of Maryland really does need to look at how do we fund residencies like we do from a federal perspective. So our journey actually started 3 or 4 years ago to this point when Tidal Health became institutionally accredited for a number of residencies. We actually started our internal medicine residency this past summer. We've been approved for surgery starting this coming summer. And we have 2 applications in progress for anesthesia and family medicine to start in the summer of 2024. Again, we're institutionally accredited. We've got great volume in pathology, and we've been working with our academic partners in the state to support additional needs that perhaps we can't supply here on this campus. Why is it important to have people train in rural environments? The vast majority of medical education training is done in urban environments. And what happens is when you train in an urban environment, you typically stay in an urban environment. But if you can identify rural environments, you're much more likely to increase the ability for us to recruit and retain onto Delmarva by having training in rural environments. So we're very happy to see our colleagues up on the Upper Shore looking at residencies as well. All of this really is contributing to a significant shortfall of physicians in this country. I think there was an article that they had project 100,000 shortage of doctors. CMS recently approved 1,000 extra residency spots in rural environments or those with needs. The challenge is, again, in the state of Maryland with the HSCRC, they're not following the federal process, which creates funding challenges for everyone who's trying to expand this crucial need. So we're really happy about where we're going. We're looking at these residencies. We're planning to get into things like psychiatry as well. Again, huge need, but we've got the volume in the pathology and every site of service needed, to establish that. We had 2,700 applicants for our 10 internal medicine residency spots. 2,700. We had 450 applicants for the 4 surgery spots. That's an example of the level of need that's out there within the medical community. So the more residencies we establish, the better. So we're well on our way, and what we're asking for, and we know it's not insignificant, but we're already spending significant money and we have additional capital related needs. Again, we're looking for temporary funding for the next 2 years. My belief is this should be driven by the HSCRC, but we need funding for the next 2 years to keep this conversation going. And ultimately, we would love to see state funding to help us out, much like I know our Upper Shore colleagues are looking for, with guidance to the HSCRC that they should follow the federal process. If you haven't had a residency, this funding should be automatic. This shouldn't be a discussion. CMS, it's not a discussion if you've never had a residency going back to 1997, like here on Delmarva in our locations. So I want to stop there. And again, thank everyone for their ongoing support. I can't stress the trauma need, though. Our board has given guidance to us that we have to evaluate services. We were downgraded from a bond perspective. Our days of cash have been cut in half at this point in time. We're now below the Maryland average. And we have to evaluate our ability to provide trauma services going forward, absent of additional funding. As a center that receives the complexity, the medical residencies are just as important. And that's why I think at Tidal Health, we are at a crossroad in many ways without this type of support. So thank you, Mr. Adams there, and we'd be happy to answer any questions.
Okay, thank you, Steve and Chris. Members, any questions for Tidal Health at this moment? So it looks okay. Delegate Hutchinson.
Good morning. Thank you, Chair. And thank you for briefing us again about the issues about the trauma center. We do have the bill being drafted currently. One small point of recommendation that I received from leadership within the Health and Government Operations leadership team is we want to refer to this as a commission. I her recommendation from Jocelyn was the term task force doesn't go over well, and she would like to refer this as a commission. I just wanted to share that with you so that we all stay consistent in our terminology.
Will do. Thank you.
Senator Mounts.
Thank you, Chairman. Great to see you this morning, and thank you for the presentation. Earlier, before Christmas, I saw where Governor Moore was scheduled to visit, but I think I caught it late, and I was going to try to sneak down, but to best of my knowledge, I believe he was ill and was not able to visit. And I was interested to know if there are any plans from the governor's office to come back and revisit, if you've had any personal interaction where we get an opportunity for the governor to come down and get a better feel, firsthand view of all the things that are going on and the challenges you're facing.
Yeah, I'll give
we were very much looking forward to that opportunity. It was unfortunate, but obviously it happens. When we walk people through Tidal Health Peninsula Regional, quite honestly, no matter who you walk through here, the immediate reaction is somewhat shock and awe about the scope of services that we have here, servicing the entire region. So I know Chris is working with the office to attempt to get a second meeting. Obviously his schedule now has become even more complicated, but that's really the best way to see what the services are is by seeing it. But at minimum, we're trying to get that audience to reinforce it.
And what is the time deadline you're dealing with as far as funding? You need to know whether the funding's coming or not, and the request is out there. What is the deadline that you're looking at? Like, there's got to be a point at which, and it would be good to know that reality. Where is the cliff that you're looking at?
So we're looking at our budgeting process for this coming year. We're projected to lose, again, probably $30 to $40 million this coming year. Trauma costs us, by the way, in excess of about $22 million to provide the level of services. And the state gives us about $2 to $3 million. And I'm not joking. That's how much we get. The trauma fund, quite honestly, is an antiquated, support mechanism that just doesn't work. The entire trauma fund wouldn't actually be enough to just fund trauma services here in Salisbury. So in our budget process, we're being guided by the board at this point in time where we've got to reconcile at this point in time. We've been downgraded on a bond perspective. So we have to know what our funding is for next year. So I think by the end of the legislative session, we have to know, do we have support? Otherwise, we have to put forth scenarios that don't include this level of service.
That's very helpful. I appreciate it. Thank you. Good to see you.
You too.
Senator Carrozza.
Thank you, Chair Adams, and Dr. and President Leonard. Thank you for the presentation. And just to share with the rest of the delegation, I want to, let our members know that you have been laying this groundwork on and raising the flag on the severity of the trauma funding issue. I know going, back to the summer, if not beforehand, and the very thoughtful letter that you put together and sent to Governor Hogan, and then of course a follow-up to now Governor Moore, really outlines the story that you just presented. So I wanted to ask if that, obviously those could be shared with the rest of the delegation. I wanted to, I think the strategy with the funding, and I believe Minority Leader Hershey is on as well. Part of this, I think, is that we have to continue not only to have our own delegation educated, but also our colleagues across the state, and really underscore the fact that this is, a statewide issue and impact. And you had mentioned, I think, that you had already laid some groundwork with some other of your counterparts in Western Maryland. And, of course, we will be following up specifically with budget chairs and ranking members and all the members on the both appropriations and budget. So can you just so we're all in an effort to stay coordinated, you kind of fill us in on that and underscore, I think, I guess, the urgency with the funding.
So Chris, maybe you can give a little bit of an update. I know we've worked through TraumaNet and engaged some of the other facilities to support the commission on this effort. But Chris, you there?
Yeah, so a couple of things on that. One is, I see it as a three-legged approach of three major tactics that we're taking. One is that, the commission, make sure I get that correct. So we're asking for the commission, and we're working with LifeBridge and Hopkins and others to get that bill to study to make sure that the trauma funding, as Dr. Leonard mentioned, is more contemporary. This was established back in the 90s, and it has minor annual adjustments on the way up. So just for everybody's edification, it is a $5 added tax to a car registrations. When people register their car, $5 is added to it. That money goes into the trauma fund. There is a significant mechanism to request funds back out of it. And that's why typically there is leftover money at the end of the year and it goes back into the general fund, because it is an arduous process that individuals have to file claims, if you will, to collect money back. So we're looking at that to be contemporary, both from a funding perspective, but also for how to receive funds back out of it. So that is a collaborative effort. You mentioned Senator Carrozza, where we're having multiple organizations come together to look at that as a commission, if you will. So that's one aspect. The second aspect is we are continuing to work with the HSCRC to modernize the funding mechanisms across the state for trauma in general. As Dr. Leonard mentioned, it is woefully behind what it actually costs to run trauma centers. And then the third one is through the appropriation. So after the conclusion of this meeting, I will send to yourself, as well as Chairman Adams and others, a copy of the letters that went out.
Seeing no further questions, let me just segue and say goodbye to Dr. Leonard and Chris Hall. Thank you for on short notice coming in. And I know that bill came as a reality last week, and we wanted you to come in and chat. But also thanks for the update on residency. I think that this is a very important issue that we've heard about over my 8 years and surely longer than that. We care a great deal about your team and helping you grow your ability to serve us on the Eastern Shore. So when we have the Secretary of Health come in, because all these new cabinet secretaries are coming in, it's usual for us to invite them in, and we'll surely invite you back with all systems to if you'd like present again. Thank you very much. Okay, so as we go toward the next panel, which is going to be University of Maryland Medical System, Shore Health, and University of Baltimore, Ken Kozel, we're thrilled to have you and, of course, the other members here today. As you know, the new hospital is top line for us, but also how you serve us is very important as well. You might know I serve on the Midshore Regional Council and have the opportunity to serve on the executive board. So I can resonate very directly with how deeply interested we are in partnering and participating and engaging with your organization at a critical moment in time for our region's healthcare. And I'm very happy to be in that spot. I know the Eastern Shore delegation is excited to hear from you, and you have the floor as long as you'd like it. And I do want to apologize. I put markers on my agenda for time frame. I did that for my purposes, just to keep the flow going, but you have as much time as you wish, and thanks for being here.
Well, thank you, Chairman Adams. We really appreciate the time this morning, and thank you to the delegation for sharing your time with us and allowing us to present this morning. I really appreciate being invited, and really want to be here to support my good friend, Dr. Bruce Jarrell, and as president of the University of Baltimore. But I don't want to cut into Dr. Jarrell's time as he presents the primary care residency program that is critical to our workforce recruitment and retention efforts on the shore. But I don't want to miss this opportunity to say thank you to the delegation profusely for your ongoing support of the shore and Shore Regional Health specifically, and our efforts to expand access in rural Maryland. The hospital project in Easton is moving forward. I'm pleased to share that we have filed the Certificate of Need application with the Maryland Healthcare Commission. We did that on January 6th of this year, and we are working with the HSCRC to talk about a full rate application for this project. So we are moving forward with the Easton Hospital, and we are incredibly excited about this project and the benefit it's going to bring to our Midshore community. We are very, very hopeful that the state will provide that critically needed funding support to this project that we talked about earlier this morning. I'm not certain of whether it will be in Governor Moore's budget budget that will be shared this morning. But I do want to assure you that we are in constant discussion and communication with the Moore administration. And Governor Moore and his team have been incredibly supportive and responsive to our conversations. And again, your support remains critical to us in order to gain Governor Moore's support for our Eastern Shore project. So I can't thank you enough for all you've done to help Shore Regional Health be the regional healthcare system that we are, the integrated delivery system for the 5 counties of the Midshore. We all know that the new hospital in Easton is one of the corner pieces of our strategy to create successful healthcare in rural Maryland. And we can't thank you enough for your support throughout this process and now up to this next important phase with the new hospital in Easton. So with that, I really appreciate the opportunity to say thank you. And I'll send the mic over to Dr. Gerald to talk about primary care and the importance that has on the Midshore. Dr. Gerald, good morning.
Thank you. And good morning, Ken. Let me begin by thanking Chair Adams and the delegation for allowing us to present this to you. And I am going to talk about a training program of family medicine in the Midshore. But before I do, I want to echo my support for the many things that Dr. Steve Leonard talked about. He and I have worked together now for 4 or 5 years. And the trauma situation on the Eastern Shore and throughout the state is important to me, I think, as it is to you. So we support that kind of thinking. We're also supportive of graduate medical education, that is residency on the Eastern Shore. Now, I haven't met all of the members of the delegation. I've met some of you. I just wanted to give you a little bit of background that I did grow up on the shore in Caroline County and practiced in Dover as a surgeon for a number of years before returning to the university as a kidney and liver transplanter. And somehow, I don't know how, I ended up as president of the University of Maryland, Baltimore. That gives me a certain perspective, and I do view UMB in particular, as well as UMMS, but certainly the university as a statewide institution with a mission to impact healthcare. And since I've been president for 3 years, the Eastern Shore is one of my highest priorities in many respects. And I don't probably have any surprises for you all, but you all know that the Robert Wood Johnson healthcare statistics for the shore are as low as they are in Baltimore City. And every time I see that, I say, wait a minute, we've got to be a part of changing them. And I think that has to do with a rural healthcare strategy with long-term commitments. You've heard some of them from Dr. Leonard, and I'm going to mention 1 or 2 more. So I don't need to mention Shore Health, but probably LARP is a term familiar for all of those, and I appreciate your support in getting that loan repayment assistance program fully funded. You may also not know, though, that UMB has had a major effort to raise scholarship funds through fundraising on the shore for kids on the shore to be attracted to Baltimore for healthcare and then return to the Eastern Shore. And lastly, my colleague, Dr. Heidi Anderson, president of EAS, is on the call, and we're working closely with her, hopefully to establish University of Maryland Baltimore medical students to be actually positioned as medical students at Princess Anne, going rotations on the shore hospitals and rotations. So I see there being a very comprehensive strategy here, which I know you do too. But there's a big piece missing there, and that big piece is primary care on the Eastern Shore, particularly around family medicine. We need to have a training program on the shore, multiple programs, and as Dr. Leonard said, there's a lot of evidence to say if you train in a rural area, there's a high likelihood you'll remain there to practice. And so family medicine residency is our approach to this in the Midshore. We have been very busy working out how to do this. We started before COVID, our School of Medicine and Family Medicine, along with Shore Health, along with Chop Tank FQHC, and I know Sarah's here on the call as well. The critical component of this is involving Chop Tank Health. We competed for a federal HRSA grant. It was $750,000. that allowed us to begin to put things in place. We involved the governor's office and the Department of Health in this effort. And we briefed the new governor, by the way, about this several months ago. We have been planning for the 3 years in spite of the pandemic, and we're really at a critical point to say, okay, it's time to go. We envision a residency of 9 positions, 3 per year. It's a 3-year residency. They would spend the majority of their training at the Chop Tank FQHC, as well as ensure health and other capabilities as needed. Of course, these individuals will have their families and friends there. They'll know the shore and its value, and we think this is a way to get them to stay on the shore in practice. What have we done already? Well, we have certain resources and people already in place to begin this process. We have built a set of relationships with our partners. They're solid, they're trusted. We now meet the standards required by the accreditors. Recruitment can start this following March, not this March, but next March. And the residents would be selected because they're committed to training on the shore. So we are ready. The window to proceed with our accreditors is open, but not for long. And we know that our chances of getting this residency approved will go down if we don't make the commitment to proceed now. That commitment is fundamentally based upon sustained funding to maintain these individuals. So right this minute, we're in a holding pattern. We're in a standstill because we don't have sustained funding. And therefore, to get it up and running, we wanted to bring to you our budgetary needs. And we certainly hope that you will adopt this also as one of your priorities. For the budget you're considering now, we would need $1.5 million to begin in FY24. Then in years 2 and 3, that ramps up to $2.5 million. And then this would need to be an ongoing commitment for us to be able to continue to do this important residency. So with that, I will stop. If Mr. Cozell has anything else to add, fine, but then happy to answer questions.
Thank you, Dr. Gerald. I will just add a few thoughts to share with you and give you a little perspective as your local CEO for healthcare on the Midshore. We've heard today through a number of presenters and speakers about how difficult it is to be in healthcare these days, and COVID has exacerbated those challenges. And it really ultimately has led to incredible workforce challenges that we've got throughout the country, but it's been exacerbated in rural Maryland. And what we have found at Shore Regional Health is the way to survive and thrive is through partnerships. And one of the success stories that I think can be demonstrated on how that works is with our affiliation and collaboration with Chop Tank Regional Health, our federally qualified healthcare system. Sarah Rich and Chop Tank have been so instrumental in helping support our primary care needs on the Midshore, so much so that we've developed a collaboration in Chestertown and in Kent County where they will become the primary source for primary care in the Kent County region with support from Shore to make that happen. But that's just one example of how we have to be innovative and creative to not only survive through these healthcare challenges, but to thrive, because we owe it to our community to be the best healthcare system we can be and provide local access to healthcare everywhere possible. So healthcare and primary care is so critically important. And I applaud Dr. Bruce Gerald as president of the University of Baltimore for his innovation and his willingness to step out front and represent rural Maryland and represent that there is a unique need for primary care on the shore. There are not a day goes by where we don't talk about primary care on the shore. I was just at a breakfast meeting in Cambridge this morning with a local breakfast club where one of the gentlemen at the meeting, his wife is a primary care provider. And she shared that with him that as she works towards retirement, she really does not have a succession plan because it's been impossible to try to recruit primary care providers to the shore. She has a 3,000 person panel. That's part of her panel that she sees in Cambridge. And if we don't develop a comprehensive solution with her, those 3,000 residents of Dorchester County will be without primary care. So these are things that we talk about every day to support the basic needs of our community, to support health and wellness in our community, And it's through the efforts of Dr. Gerald by increasing the number of residents that come through our community that is going to help us solve this problem. And I agree with what Dr. Leonard said this morning, as well as Dr. Gerald, that when you bring residents to the shore, they get a chance to indoctrinate themselves into our culture. They love it. They stay, and they want to stay and build a family and build a community with us. We have proven that time and time again in other areas. Emergency medicine is a great example where we have been able to recruit emergency medicine physicians to the shore through a residency program, and they have helped staff our 4 emergency departments on the mid-shore. It works. We know it works, but we need your help. We need your support to keep this funding alive and get it out of the holding pattern that Dr. Gerald talked about, and really help us launch this into bringing residents to the shore and starting to train them at Chop Tank and at Shore Regional Health. So thank you so much for the opportunity to share our story with you, and to share this need with you. And as always, we are available at any time for you to support you and to give you the information that you need to be effective at what you do. And again, I take this opportunity to thank you so very much for your support of Shore Regional Health, everything we've done on a county by county basis, and culminating with the Easton Regional Medical Center. It's critical that our Midshore community gets the best access to healthcare that we can provide. And as part of the University of Maryland medical system, the shore is a critical component, and we're going to make sure that that happens. So thank you so much for your support and for your time today. And I'll stay on the line with Dr. Gerald to answer any questions you might have.
Okay, thank you, Ken. Now, I see Sarah Rich with Community or Chop Tank. Would you like to share a few moments, just your thoughts on the partnership and for the delegation?
Well, absolutely. Thank you, Chairman Adams, and thanks to the delegation for hearing us this morning. I agree with everything that my esteemed colleagues have shared. This is definitely a huge need for us here, and it is time to take action. I recall being part of the Maryland Rural Health Collaborative with Ken, and a lot of the discussions certainly were focused on workforce on the shore. As you all recall, that was put into place with Senate Bill 1056 back in May of, I think, 2018. And a lot of work went into that. And there was a lot of support to move forward with these residency programs. So this is now the time for us to see that through to fruition. I think in terms of the need and what the impact can be, not only providing more access to care on the shore, which is, the primary need, but, it also is a recruitment tool. And I can tell you, I've talked with physicians that we have brought on to Chop Tank over the last couple of years. And when we talk about the opportunity to be faculty and to participate in the residency program, they get really excited. A lot of the physicians are very passionate about teaching and want to have that opportunity to participate and serve in that manner. So, as Ken said, the workforce piece is really critical. We want to get the physicians here so they can see the Eastern Shore and fall in love with it like many of us have, build families, live and work here and make a difference. So we're very excited to move this forward. It means so much to Chop Tank and to Shore, and certainly to the residents that we all serve together. So I'm very honored to be part of this partnership, and we really want to see it move forward because it's going to do so much good. So thank you for the opportunity.
Sarah, thank you. And, I toured your facility maybe about a year or so ago, and you will be a terrific partner in this. And your organization, it was in top form when I was coming through. So a lot of thank yous going around to our healthcare partners. We'll surely be here for you as you would expect us to. Okay, members, any questions? Delegate Grice.
Thank you, Mr. Chairman. It's not a question, but just a comment. So the governor will be releasing both the operating and the capital budgets today. And I just sent a text message to Eric Lukey to ask him if that budget will be available to the public online. So as soon as we get the information, we'll be sure to share it with you guys.
So high news. Senator Mounts.
Thank you, Chairman. I just quickly wanted to thank Ken Cazell and Dr. Gerald for being on. We talked about the hospital and the future of healthcare earlier, and one of the things that comes up frequently when you talk about a new hospital is well, that's great. That's great. Matter of fact, the first time publicly that I talked about it. I was criticized for that because the first question was, what are you doing about the doctors and the nurses? You know, we need doctors and nurses. So this is it's great news, and I really can't thank you enough for taking the lead. Dr. Gerald, it's great to meet you, and thank you for your support of the shore. Having a stalwart, somebody that's grown up, you know, and understands kind of the way things happen and how to make things happen is just, it's priceless. So thank you very much.
Thank you.
Any other questions from the members? Seeing none. Dr. Gerald, thank you very much for the presentation. Good to meet you as well, and all the best. And we'll take this recommendation through and see how we can support you through through all of our paths to do that.
Thank you. It's a pleasure to be before this distinguished delegation.
Thank you very much. Okay, members, we are now going to move to Maryland Association of Counties. So Michael Sanderson, Dominic Butchko, and Kevin Canali. I think I have that right.
Very good.
The floor is yours.
Thank you very much, Mr. Chair and delegation members. Pleasure to join you this morning. I'm Michael Sanderson. I'm director of the Maryland Association of Counties. We represent county governments across the state, wide variety of issues. I know many of you and glad to continue relationships. Glad to build new ones with many of you on the shore. Our organization serves everybody, but we do recognize that we have a special relationship with smaller jurisdictions who don't have the wherewithal to have multiple professional staff in Annapolis and focused on legislative session throughout the year. We know our responsibility to the more rural jurisdictions is an important one, and we take that very seriously. We want to just take a couple of minutes of your time this morning. I'll do a really quick run through of a few issues that MACO's taking up as legislative initiatives for the year. I will say that an awful lot of the work that our organization does over the course of every legislative session is responding to things that come in and either playing defense or looking for opportunities to improve ideas that come from members of the General Assembly. But a few things that are on our mind, a number of which I think will resonate with you all, and we hope we can gather your support for. One is, we know that from the police reform legislation from a couple of years ago, every sheriff's deputy, every police officer in a county law enforcement agency is going to need to be equipped with a body-worn camera in the space of about a couple of years. We've got a window of time to do this well, and we think that requires a couple of things. We'll be working with sponsors from a House work group on body-worn cameras to try and get a bill to provide some sort of state leadership on buying the cameras, setting up places to store the footage and so forth. So the idea of some ride-on contracts, let's all save money with economies of scale if we can, and all buy good cameras that everybody can use and get training for, all seems to make sense. We also think that there's an important bill that needs to pass to change what we do with that footage under the Public Information Act. All that footage is just lying there waiting for someone to walk in the door and say, I want all of it from all your officers from the last 9 months. That could be extraordinarily expensive and expose children, victims, confidential informants, all sorts of problems unless we get some clearer rules on who can walk in the door and just say, I want everything. We know that with voters approving adult use cannabis, we know that the implementing legislation is coming this session through one or more legislative committees. Most of the states who have done this have looked at their local governments and allowed an opt-out to say if a jurisdiction doesn't want growers or doesn't want the sellers. Most jurisdictions have said that should be a local decision. We would like to keep that in place in Maryland. I don't know the breadth of jurisdictions that would take that up, but that local flexibility is something that we will be arguing for. And there's going to be some revenue structure over the newly regulated and legal product. Most states have had local governments participate in that revenue structure. We'd like to have the same thing happen. It's the burdens and management is going to be on the local governments, particularly on the counties. We think that there ought to be an opportunity for us to get some offset for that. I'll mention education spending. I know from comments earlier this morning in the conversation that the Kerwin blueprint is on county's mind. We know our county officials are thinking about it. We know that you representing your jurisdictions are thinking about it. We are too. There's one particular element we're going to play a little bit of small ball on an issue that I think we ought to be able to win on. As a result of the Blueprint Commission, the Oversight Board, and so forth, there may be some opportunity for more transparency in where the money comes from, where it goes to, how it's being used, and so forth, just sort of in the budgeting process. Schools don't come before county governing bodies in the same way that our Park and Rec department do to sort of defend line item in their budget. We don't want item control. We're not putting in a bill to do that, but as the state changes budgeting systems and the implementation board has more opportunities for transparency, we're hoping county government officials can be part of that transparency as well. I think that would benefit stakeholders and families as well. And finally, I'll mention this is an issue that's bubbled up from our membership. We know fire service is in crisis recruiting and retaining staff, both at the volunteer level and for the larger counties that have professional, career firefighters. This is a big issue. It's one that we were thinking about doing a bill for this year, but we're going to settle for a commission to try and bring together stakeholders to try and sort out what should be next steps. But we have career and volunteer firefighters, a number of the agencies who are adjacent to them, and a big input from county governments to come back with a bill next year to say, here are some arrows to throw at this issue. But the future of volunteer service is very much in question. We need to be doing this smarter and better, and probably in a statewide way rather than a little here and a little bit there. So those are 4 MACO initiatives. I know education funding is on everybody's mind. We'll have a budget drop this year, a lot of moving parts. The budget process will be a little different this year. I know in the room with me, Dominic Butchko works really closely with our Rural Counties Coalition and also is our lead policy person on land use and environmental issues, which tend to bubble up on the shore in particular. I think Kevin Canali is joining us as well. Kevin takes the lead for MACO on a lot of our tax and fiscal issues and is in the Ways and Means Committee an awful lot on that sort of stuff. All of the MACO staff are here at your service as a resource. You know, we do advocacy on bills and so forth, but also if something comes up and you're just wondering about a bill and how might this affect county governments, give us a call, drop us a line anytime. We're happy to be informational resources as well as advocates. We want to be partners wherever we can. So, Mr. Chairman, I'll cut it off there. Thanks very much for the opportunity to chat with you today. I also enjoyed hearing about all the issues earlier today, issues with hospitals and medical care. Obviously, thinking about the safety of your citizens, that's what we owe you as well.
Very good. Michael, are the other 2 going to present, or shall we just go ahead and go to Q&A?
I think if you have questions for any of us, that's probably fine. We want to be respectful of your time. I know you've got a busy agenda, so if that's okay, that's our quick rundown, and we're available. We're pretty easy to find.
Okay, so I do have one question. Cannabis came up. I'm a member of the Talbot County delegation, and do you have any broad stroke thoughts on what's going to happen this year with regulation on cannabis, and what are you hearing from your members as to maybe top line concerns as regulations are being drawn?
Yeah, I think we've got a couple sort of local autonomy issues that are sort of bread and butter things for a group like MACO to say we ought to have the ability to opt out. Say if a county or a city says we don't want to have sellers in our area, we don't want to have those licenses. Most places have done that. New York, it's a place like Colorado that we think of as legalized cannabis. They've told their towns and cities, if you don't want it, you can opt out. And the map is a checkerboard, but everybody considers Colorado an opt-in legal state. There's going to be a revenue structure. Some of it ought to come back to the counties, whether it's our own tax or whether it's a piece of the state pie. That's TBA. I think there's a few other issues that are difficult. Workplace issues are tough. We've got public safety places that need to have a drug-free workplace in order to stay eligible for federal funds. That's a pretty big deal. I don't think the state would snub its nose at things that are structural like that. But governments, local governments as workplaces are thinking about that sort of thing, on the job as well, even for folks who don't drive a cruiser and that sort of thing. So it's going to come from a work group. The Senate has joined in with the meetings of the informal work group that the House has had for some time. That's a pointing toward progress, but nobody is walking around town with draft bills or pieces of paper that say these are the 11 points of the emerging plan. Doesn't look like things are that far along yet.
Yeah. I mean, it's interesting. We had MML on last week and the question was asked and they talk about autonomy. You don't need to answer this, but I'm curious what will happen if a municipality says we want it and the county that municipality exists in says no. And
right, it's a natural tension. We tend to agree with our municipal partners about local autonomy and so forth. It kind of depends what the structure would look like and what the funds are to be used for. So I think there's a lot of TBA there. We're not looking to go to war with our municipal partners. We agree with them on an awful lot of things. So if there's a pie to be split among the local governments, that's one avenue that would make sense. If it ends up being targeted for education or something else like that, I mean, everything's going to get caught up in this discussion about the blueprint and about Kerwin in the years ahead. That's at least another avenue that the legislature might take as well. I don't know how it's going to play out.
All right, thank you, Michael. Senator Carrozza.
You're muted, Senator.
We can't hear you, Senator.
Thank you, Chair Adams. And Michael, thank you. And your team is great. Obviously, a lot of your issues come through EEE and sometimes they pop really fast, as you know, and we're literally trying to, text and find out, especially if it pops and we didn't have any warning, not only where Mako is, but I also specifically asked how our shore counties are, which sometimes is a different position than the bigger counties. So thank you for the responsiveness. You hit on obviously the major issues and priorities for this session, but 2 quick points, and I'll make it brief. On the work that you're doing with the Maryland State Firemen's Association on the recruitment and retention, and I know some of us, are saying, there is a sense of urgency, and I know you mentioned the commission, but if there's anything we think that we should do this session now, immediate, I think, this delegation would want to push for that. So I want to kind of flag that. And then 2, on the Kerwin and the transparency on the money, again, I think that is a priority issue. And if we could get into a little bit more on the follow-up on the details of that, I think that would be helpful to all the members of our delegation.
We're at your service on both topics, both very well received. Thank you.
Okay, any other questions from the members? So Michael, I'm new at the chair gig. But I understand there might be a question that one of the commissioners would like to ask. Are you okay with me opening the floor up to one of the commissioners for a quick question? Okay.
Sure.
Larry Porter, would you like to go ahead and do that?
Chairman, I did not have a question for Michael. I had a general question at the end, if we can wait.
Okay, thank you very much. Okay. Michael, seeing no further questions, thank you very much and your team, and I'm sure we'll be heavily engaged through session this year.
Very good. Thank you all.
Okay. So members, we're going to have the federal updates. So of course, we heard from Senator Cardin at the beginning. Do we have Andy Harris's office? I think maybe Keith Graffius is on with us this morning.
This is Mike Arntz. I don't know if Keith is on or not. I haven't seen him on the screen, but I can give you a little bit of an update.
Okay.
Congressman Harris was given the chair of the House Appropriations Committee, subcommittee that handles funding for Department of Agriculture, Food and Drug Administration, some other agencies. Of course, there's a little bit shorter than expected window to negotiate the debt limit this year. So hold your breath, and hopefully we won't be running into a debt limit that causes us to have a government shutdown. And then just finally want to mention Congressman Harris has called for a moratorium on the windmill construction. I think a lot of people are aware of the issues ongoing so he's called for a moratorium so that we can determine what's exactly happening with the whales, and a couple of them have been beached on Aztec Island. And then finally, I want to give a shout out to Delegate Grice, who made a tremendous presentation about what you all are doing in Annapolis at the CRW meeting last night. And unless Keith is on to add anything, that's it for me.
Okay, Senator Van Hollen's office, is Alyssa Hastings on? Good morning.
Morning, Chairman. Alyssa Hastings, Eastern Shore Regional Director for U.S. Senator Chris Van Hollen. Great to see you all this morning. No update from my office this morning.
Okay, Kim, I'll surely ask you if there's anything you have.
I think the senator covered most of what I would have covered this morning. So thank you very much. And thank you for your time this morning.
I do believe that he did. And thank you for having him today. Okay, members, any questions of the delegation, or shall we go ahead and move along? Delegate Grice.
Oh, no, I just wanted to make a comment. I thought this was the end of the day. My apologies. So we're going to be getting in those budget books today, guys. So that way, both the capital and the operating. So look out for them.
Okay, very good. So we're toward the end. We can have it for open question. I do want to say that it's probably going to take just the right kind of bill for us to do an Eastern Shore delegation bill. I know that the issue with LEOPS is coming through county by county. I heard this morning from Talbot County, where they're asking for a same request. So what I think we might do is just Kevin, just take a week, and maybe we can talk a little bit more about this. I know that there's that statewide bill that's floating around though, so we may want to talk amongst ourselves as to how to approach that. And then for next week, I think what we'll do is on the agenda at the end, we'll lay out the formal requests for support letters on the issues we've heard from the past couple of weeks, specifically Senator Croza and Delegate Hutchinson's bill. We'd like to at least get close to that if there's language, or if you get the bill language in, so we can share that with the members. I'm sure we'll be behind that. And then I'm not sure how often the delegation writes letters of support for funding requests, but I'd like to discuss that during next week's meeting, and we'll send them notes from our two health providers that were making those requests, so we can specifically discuss that. And we'd like to make a motion on those two issues next week. I'm not remembering specifically if there was anything last week that was an open request in the hospice front for letter writing or request for support, but I'll revisit that. And with that, I'll leave the floor open to questions or comments from the members, and then Commissioner Porter will jump in at the end there with you. Okay, seeing no questions from the members, Commissioner Porter.
Yes, good morning, Chairman. Thank you very much. It was an honor to be on the call with Dr. Gerald, who is a Caroline County citizen or Caroline County resident, was born and raised in the county. We certainly are proud and thank him for all of his help. I wanted to go back to your meeting last week. I've caught the tail end of it about the hospice conversation. As many of you know, I have been working trying to get hospice beds in Caroline County for probably since 2012. You all know my position on the certificate of need. I don't like it. I think it's does not serve us well. But I just want to emphasize my position here that despite promises since that time, since 2012, we still do not have hospice beds in our county. I met on December 8th with the Compass Regional Hospice CEO. Still have not heard anything. So if that was let's just have a meeting and shut Larry up meeting, but many of you who know me know I don't shut up very well, and I'm not going to. So I just want to emphasize that. It is important for us, and it has been promised for many years that we would have beds in our county. And I just wanted, I've expressed this to many of you and appreciate the opportunity. And I just wanted to mention as well, please don't forget about our concerns about battery storage components on solar fields. Thank you.
Thank you, Commissioner Porter. All right, so next week, and I want to just close, and we'll adjourn the meeting, but next week we're going to have Midshore Regional Council. We're going to have our education partners in next week. And what I would ask is, like with what happened with Tidal Health, that was an emerging issue that brought them forward, and we were able to find a cooperative panel to discuss healthcare. I thought that worked terrific. So if any of the members have suggestions to add, presenters, that please do that. We've been putting together a pretty good list, but I think it can be organic and also need-based as issues emerge. Most of the cabinet secretaries, if you might imagine, have declined because those were under the Hogan administration. And now that we've got new named secretaries, I know that the named Secretary of Ag, Kevin Addix, has asked to present to the group. So what you could expect from a handful of these future meetings are the hopes that we'll hear directly from the Moore administration through their nominated cabinet secretaries, and we'll start that as soon as they're willing to come on and say hi. So we'll leave it there. Any other further business to attend to? I need a motion to adjourn.
Delegate, if I may just say one thing.
Sure, go ahead.
Sure, I just wanted to say that thankfully Chicken Day is coming back to Annapolis. We're going to have that on February 28th from 11 to 1 at Governor Calvert House. I'll be sending out formal invites, but I just wanted to put that out there so you all can put it on your calendar.
Okay, very good. Any other member communities, organizations that want to chime in? Sorry, Grace, I should have probably opened that up that way. Still working on this gig. All right, need a motion to adjourn?
So moved.
Second?
Second.
All right, all those in favor?
Aye.
Aye.
All right, thank you. Have a good day.
Happy Friday, everybody.